When I teach the hematology section, one important concept that I see nurses miss is what are patients who receive frequent blood transfusion at risk for? A 9-year-old patient with beta-thalassemia major receives frequent blood transfusion therapy. Which long-term complication should the nurse monitor for? So A, splenic sequestration. So this is a complication that patients with sickle cell anemia can develop. However, it's not due to frequent blood transfusion therapy. So let's cross off A. And then B, secondary hemochromatosis. So let's just hold this answer for now. And then C, increased risk of infection. That's not a chronic risk factor we're looking for. So we'll cross off C. And then D, acute chest syndrome. This is another complication that patients with sickle cell anemia can develop, but this is not due to frequent blood transfusion therapy. So we'll cross off D. So without even knowing what B is, through process of elimination, we're able to get the correct answer of B. So patients who receive chronic blood transfusions, they are at increased risk for iron overload. And so while these transfusions are life-saving, every unit of red blood cells contains iron. And the problem here is the body has no natural way to get rid of excess iron. And so over time, iron can accumulate in organs such as the liver, the heart, and the pancreas, and can cause serious complications. So because of this, patients who are receiving chronic transfusions, we want to monitor closely their iron levels. So remember, chronic transfusions improve anemia, but iron overload becomes the major long-term complication. So I hope you found that helpful. Follow for more pediatric hem-onc education and CPHON exam tips.